What's up? I'm Hutch, and you need to better understand spinal cord injuries above T6 so that you can determine your patient's function and how to better help them, and also pass the NPTE. Remember that every patient will have a little bit different signs and symptoms of their injury, even if they're at the same level, but this will hopefully give you a little bit of a guideline. Patients with a C1 through C4 spinal cord injury are typically pretty dependent. They use motorized wheelchairs with head controls and typically rely on mechanical ventilators for breathing. They may have some very limited speech capacity, but they'll be very susceptible to illnesses because they won't be able to have a functional cough and clear secretions on their own. At this point, there's no sympathetic nervous system innervation, which is your stress response, meaning that their body will have a low heart rate, low blood pressure, and low body temperature, which will also make them susceptible to hypothermia. Patients with a C5 through C8 spinal cord injury are a little better off. They may be able to participate in some transfers, dressing, as well as manual wheelchair movements on a flat surface. Patients without grip strength will use what's called a tenodesis grip to pick objects up, meaning that when the wrist is flexed, the tendons in the fingers are shortened, and so the fingers are able to open, and so they can put their hand around an object. Then, when they extend the wrist, those tendons in the fingers will shorten, causing the hand to grip whatever they're grabbing a little bit. And so they'll have a weak grip and a weak ability to pick things up. Independent inspiration is possible at this point because the diaphragm and scalenes are both available for use. However, some patients may have what's called paradoxical breathing, which is when the chest will expand during the patient's exhale, which is contrary to the norm. At this point, these patients should also all have some type of weak phonation and weak cough, although they still don't have any sympathetic nervous system innervation. Because of the lack of SNS innervation, these patients will be at risk for orthostatic hypotension, which is where the blood pressure can drop dangerously low during positional changes. So for example, supine to sitting. This can cause dizziness, lightheadedness, passing out, and can be worse with the more static these patients are. Patients with a T1 through T5 injury will be a lot more functional. They'll be completely independent with a manual wheelchair, and they may be able to drive an adapted vehicle. Standing or ambulation may be possible, but it will require a lot of effort as well as standing frames, bracing, and a lot of extensive equipment. They'll have a little bit more intercostal innervation, and so they'll have a stronger cough than they would at a higher level, but still not really a functional, good, strong cough. These patients do have some SNS innervation to the upper body, allowing thermoregulation and some response to stress. However, they will normally rest in tachycardia. Now, for any patient with a spinal cord injury above T6, the most dangerous complication is autonomic dysreflexia. And this occurs because, again, there is very little SNS innervation. And so when there's a painful stimulus, like a pinched catheter or clothing that's too tight, or you sit on a tack or something like that happens below the level of injury, the SNS can't respond to that stress. So instead, the ANS overreacts to that stress. This will shoot the blood pressure through the roof. These patients may also have a pounding headache, sweating or flushing above the level of injury. They may have double vision, they may pass out or even die because the blood pressure is so high. The most important thing that you can do for these patients is keep them sitting up. If you lay them down, that gives the blood pressure more opportunity to get even higher, which will be very dangerous for the patient. So number one is you're going to sit those patients up. The second thing you'll do is to check for that painful stimulus. If you can remove it and the symptoms start to go away, then you're in a good spot. If those symptoms don't go away, you may not have found the correct stimulus, and so the best option is to call 911 and get some more help. Now it's time for NPTE Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. Again, this is a life-threatening emergency. Sit the patient up immediately if you suspect autonomic dysreflexia to avoid that blood pressure going even higher. Hopefully this covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy, or you can drop a comment below with questions or suggestions for videos I should do in the future. Otherwise, good luck studying and go change the world.